let me just start. I guess I can take my first question off, such as how do we get HRSA and the Indian Health Service back into the public health mode? I guess I can get rid of that question. But let me say, it's the end of December of this year, and the President has just signed comprehensive health reform. Supposed to clap, supposed to clap. How do each of you think about your programs, and how do those programs re-engineer themselves in an environment in which everybody now has a card? Now, we understand having a card doesn't equal access, but you do lots of stuff. So how do you re-engineer your programs?
Well, I think we have a lot of work to do in the Indian Health Service in terms of education of our patients. We are the example of you all can have access to health care but still not have access to health care. So it's going to be really important to first educate our patients on, if they do get additional health insurance options, what that means in terms of how they interact with our system and how they interact with other systems. So primarily, I see us doing a lot of patient education. The second thing is training, helping our workforce understand what new options and new coverage might mean for the work that we do. The other thing that we're really going to have to do now is step up our game and be competitive. Because now if American Indians, Alaska Natives, all they had was us, and now if they have other options, we may lose a lot of patients to other healthcare systems. And it's now our job to figure out ways to be more competitive, to provide better customer service, to demonstrate that we provide quality services, and to find a way to be responsive to our patients as our customers so that we can continue to provide healthcare services for them. It may result in more demand for us, it may result in less demand for us, but it's certainly going to be a lot of work. I know that in the Department of Health and Human Services, we're now starting to envision and imagine what work is going to need to be put into place for all of our agencies to adapt to all of the multiple provisions in that huge health reform bill. But for us, it's a lot of education, a lot of training, and a reorientation towards being competitive in the healthcare marketplace. Before, we really didn't think we had, if it's the only option your patient has. You know, that's true for some community health centers. You're the only place in town for them to go. But if they have access to insurance and then can go other places, we have to find a way to be competitive.
A couple of comments in response to that question. First of all, as you all know, we don't have the final print yet, so still a work in progress in terms of what we'll see with regard to health reform. But we do know that, using Massachusetts as an example, health centers still play an extremely important role in providing primary care, preventive health services, in spite of the fact that that state has embraced now broadly, almost fully insured approach to their state's population. So, in fact, health centers' efforts there haven't diminished or abated at all. They're still a key player in the delivery of healthcare services. Additionally, health centers provide a lot of wraparound services, really important to ensuring that people have access to high-quality care. So it is very much about the one-on-one care that individuals receive that's quite traditional inside an ambulatory care setting, but it's about a lot more than that with regard to what individuals and families receive when they step through the doors of a community health center. So transportation, translation, case management, health education, et cetera, all parts of the care that are delivered through health centers. It's probably also worth noting that health centers provide care not just to uninsured, but also to Medicaid covered patients, to Medicare, and to private pay individuals as well. On the workforce side of the equation, and Yvette was commenting a bit from her perspective on that front, every piece of legislation has features related to health workforce. And the Health Resources and Services Administration have really the key workforce programs in terms of production, supply, and deployment. When you think about the National Service Corps or the Title VII, Title VIII programs that focus on primary care, dentistry, nursing, allied health, and public health, and so on. And so, so you can look forward, given that we're seeing these in all pieces of legislation. While I said, you know, the fine print isn't dry yet on what health reform is going to look like, it's pretty clear that we're going to have workforce expansion because of the attention in all of those bills. And so obviously that directly impacts the deployment of that set of HRSA's programs. So a couple of examples.
Well, now both of you are engaged in efforts to upgrade the nation's health information technology. What should the public health community be doing right now to get prepared for that and to engage what you're doing?
Well, I think it's critical that we look at all of the options related to and the impact of health information technology. In the Indian Health Service, we actually have had for many years, even when I was a practicing physician back in the 1990s, a patient management system, an electronic patient management system that has been upgraded significantly over time. I think it's important for us all to embrace technology, for us all to do what we can to learn about it and how it can improve our practices. I think it's also important for us to not forget the human side of healthcare. I've been in the doctor's office with my mother several times in the last few years where the practice had a new electronic health record. And basically the doctor sat looking at the screen the entire time with their back to us and you know, was more interested in making sure they clicked on the right drop-down box than establishing a human relationship with us. And so I hope as the public health community, even though we're embracing technology, which is going to be important for us to do better business as healthcare, for us to measure and provide better quality care, we can't forget the patient in the middle of this, and we have to remember the human aspect of medicine and public health.
Yes. I'd make just a couple of comments from HRSA's perspective. Information technology is extremely important across the portfolio of programs that we have. For example, you've seen some increased infusion of resources through the Recovery Act into our health centers to help support and build out their IT infrastructure. We also have the Office for the Advancement of Telehealth. So we're in this knee-deep out of our programs in HRSA. In addition, some of our workforce programs actually are increasingly focusing on training associated with and targeted toward informatics and so on. So we touch this in a lot of different ways. A couple of comments to make about it. One, you would bring a perspective that could inform what we're doing and how we're doing it as we move that agenda forward. And I really invite representatives of the public health community to help us think that through. From my perspective, is really about a web of information technology that sits over a population. It isn't just about dropping it into this individual critical access hospital or into this community health center. It is about the connectivity across communities and regions. And public health and local health departments, for example, need to be part of that. So help us think more broadly and help identify for us the barriers that you see that we can be part of overcoming from your perspectives. It's really, I guess, an ask for your expertise because we've got a stake in this in our HRSA programs and a siloed approach to the deployment of this type of technology I don't think is going to serve anybody very well if it's just clinic by clinic. Instead, from my perspective, it's really community by community. So a couple of thoughts.